Hello everyone, my name is Dragan Radovanović and I will present basic and some specific facts about physiotherapy, intervention and rehabilitation of ski injuries. But first, let me briefly introduce myself. I'm a medical doctor, specialist in sports medicine and a full professor at the Faculty of Sport and Physical Education, University of Niš, Serbia. This is the second time for me to be a part of International Teaching Week. Unfortunately, this time in the online format. 4.5 years ago, during 9th International Teaching Week, I had a really nice time in Olomouc and honestly hope that Palatsky University will continue with this event on site and again show great hospitality for all participants in forthcoming post-COVID period. As you know, alpine ski racing is a physically demanding sport and presents a high risk of injury independent of age or gender. The most commonly injured body part in adult ski racers is a knee, and the most frequent diagnosis is the rupture of the anterior cruciate ligament or ACL. The second most commonly injured body parts are lower leg or back. And after that, the head or an upper extremity or the upper extremity alone. If you take a look at the numbers, you can notice a really high incidence of injury at the top level of competition, with 23 to almost 37 injuries per 100 athletes per season in World Cup level. From my point of view, expectedly, the highest incidence of injuries was recorded in downhill, followed by Super G or Super Giant Slalom and Giant Slalom and Slalom. But the interesting fact was that almost 45 of injuries in World Cup athletes occurring during competition, despite the fact that most of loads being taken during training. Also, maybe is an unexpected fact that an increased frequency of injuries was recorded during the last segment of races, which indicate that physical and mental fatigue should be considered as a significant risk factor. Like in adults, the most commonly injured body part in youth ski racers is the knee, while the second most commonly injured parts were the spine and head, followed by lower leg or foot or ankle. ACL injury is the most frequently specific diagnosis in the ski racers below 18 years, so it's the same situation like in adults. Recently published review articles highlighted a relatively high percentage of ski racers are able to return to their previous level of competition after ACL injury. Moreover, review article highlighted no statistically significant difference between female and male ski racers' ACL injury rates, but a higher risk of ACL injury in female ski racer aged 14 to 19 years compared to male counterpart. On the other hand, reports pointed out that almost 19% of ACL reconstructed skiers suffered a re-injury to the same knee. ACL injury mechanisms in elite ski racers, being distinct from those in recreational skiers due to higher loads on the knee in ski racers. Skier error and technical choices were described as the dominant factors, putting the athlete at the high risk of injury. Three mechanisms of ACL injury have been identified in video analysis: slip catch, landing back weighted, and dynamic snowplow. The slip catch mechanism accounts for approximately half of the ACL injuries and typically occurs while turning. The skier becomes out of balance in backward and inward direction and loses snow contact and pressure on outer ski. Subsequently, the inside edge of the outer ski suddenly and unexpectedly catches the snow surface, leading to excessive knee joint compression, knee valgus, and internal rotation. Almost similar order of events and similar loading patterns were ascribed to dynamic snowplow mechanism. However, in snowplow mechanism, it is inside edge of inner ski, not the outer ski as previously described. So the inside edge of inner ski suddenly and unexpectedly catches the snow surface. The landing back weighted mechanism typically occurs during jump landings. During the flight phase, the skier loses balance in backward direction due to backward directed angular momentum obtained at the jump takeoff. As a result, the skier lands on the ski tails with a large cap angle. At the initial contact with the ground, a forward directed angular momentum rotates the ski forward when the skier falls backward, resulting in tibiofemoral compression and both induces anterior draw on tibia relatively to the femur. An overview of ACL rupture is presented on this slide. And maybe I can say that is 4 steps process and that relatively everything is simple, and in first the athlete provides a typical anamnesis, the examination is standardized. After a few days for elite alpine ski racers, a surgical reconstruction is the only choice, and then ski-specific rehabilitation programs have to be implemented. But in reality, in ski practice or in clinical practice, nothing is simple. First thing first, the athlete suffers an acute knee sprain followed by swelling within hours caused by bleeding and pain. A pop sound is often reported. Positive Lachman test and anterior drawer test are presented. Just in brief, the Lachman test is a physical examination maneuver used to assess the integrity of ACL in suspected ACL injury. The test is used to evaluate the anterior translation of tibia in relation to the femur and is considered as a variant of anterior drawer test. On pulling the tibia anteriorly, an intact ACL should prevent forward translation movement on tibia on the femur, so-called Fuhrman fill. On the other side, anterior translation of tibia associated with soft or mushy end film indicates a positive Lachman test. I have to tell you, when it is performed correctly, the Lachman test does not hurt. However, the test requires the athlete to be relaxed in the supine position, so in acute situation, this test is difficult to elicit. After clinical examination, a compression ice bandage should be applied to stop bleeding and followed by rest therapy, rest, ice, elevation, and compression to control swelling. The athlete should use crutches and avoid full weight bearing. ACL surgery, I will briefly explain on the next slide. Ensuring that athletes have sufficient time to rehabilitate after ACL injury and that the associated injuries are given appropriate recovery time is important, not only for achieving a safe return to pre-injury performance level, but also with regard to preventive long-term health consequences, such as the early development of osteoarthritis. It seems critical to ensure that the lower limb nerve function is adequately restored following ACL injury and that skiers are fit to return to this high-risk activity. Currently, there are no generally accepted protocols rehabilitation programs following ACL reconstruction in alpine ski racers. Moreover, there are no generally accepted protocols for returning alpine ski racers back to the snow after the ACL injury. Unfortunately, mistakes are not rare during rehabilitation programs following ACL reconstruction. Reasons are different, but the three most common are: first, as I said before, there is a lack of clinically applicable guidelines for rehabilitation after ACL reconstruction in alpine ski racers. You have to understand this fact. The physiotherapists want to sell their education and professional experience, not to publish an academic paper. Second, progress of athletes during the rehabilitation process is based on criteria that might not be sufficient to deal with the demands of the following phase. I talk later about functional testing after ACL reconstruction. And third, in clinical practice progress is often too quick during rehabilitation phases. Just briefly, ACL surgery is usually done as an arthrotopic surgery by making a small incisions in the knee and inserting instruments for surgery through these incisions. In some cases, it is done by cutting a large incision in the knee and then called open surgery. The surgeon, or more precise, orthopedic surgeon, insert an arthroscope into one of these incisions. A camera at the end of the arthroscope transmits pictures from inside the knee to monitor in operating room. The surgeon drills small holes into the upper and lower leg bones, where these bones come close together and the knee joint. The holes form tunnels through which the graft will be entered. The most common grafts are autografts, using parts of own body, such as patellar tendon graft or one of the hamstring tendons. A battery of standardized and reliable neuromuscular assessments that are objectively determined and specific to demands of alpine ski racing should be employed to evaluate an alpine skier during rehabilitation programs following ACL reconstructions. Assessment of functional asymmetry. Hamstrings to quadriceps muscle strength ratio, including the rate of force development capacity. Quadriceps versus hamstring muscle coactivity and fatigue resistance should be employed to evaluate an alpine skier during rehabilitation programs. Additionally, rehabilitation programs should be ski-specific and account for the unique physical and technical demands of alpine ski racing. Moreover, the skier's psychological readiness for return to sport is also important, as ski racers may be prone to poor decision-making at the transition from rehabilitation to on-snow training. As you probably know, isokinetic dynamometers with optimal loading of the muscles in dynamic conditions, the constant pre-selected velocity of movement, and the record of applied force throughout the joint range of motion provides safety in the rehabilitation process. Recently, my colleagues and I started to use tensiomyography for assessment during rehabilitation programs following ACL reconstruction. Briefly, tensiomyography is an in vivo, non-invasive method to examine mechanical and contractile properties of the skeletal muscle. Tensiomyography using a digital displacement sensor for an electrically stimulated contraction to record the radial displacement of muscle. Of course, the best results are obtained if there are data from the examination of the same athlete before injury, because that represents the guidelines during rehabilitation program following ACL reconstruction. It has been suggested that prevention measurements should be derived from risk factors. Injury causes need to be well understood prior to being able to develop effective preventive measurements that reduce the risk of injury. Researchers in this field identified more than 15 risk factors, but I decided to show you only those related to athletes, like fatigue within a race or training session, inappropriate tactical choices, insufficient physical fitness, and technical mistakes. Although some preventive strategies have been implemented in recent years, their effectiveness in decreasing the risk of injury is still unclear. During the past few years, the general recommendation for injury prevention programs in youth ski racers is focusing on coordinative-oriented strength training instead of focusing on maximum strength training. Recent reports emphasize that the constant adaptations to the changing outdoor environments, what that's mean snow and ice condition, require a very well developed intramuscular and intermuscular coordination in order to perform better and more precise short-lasting movements coordination. Based on these findings, injury prevention works out for youth ski racers should focus on neuromuscular training sessions, including agility aspects. I have to tell you, I didn't have professional experience with World Cup level ski races, but during the past few years, I had interesting cases with youth ski competitors. The girl on your left-hand side had 4 surgical interventions to ACL reconstruction, Hunter lesion, and meniscal tear on the same knee before she came with her parents and coach first time to see me. It was a period after her second ACL reconstruction. Having in mind the risk of developing symptomatic knee joint osteoarthritis later in life, at first, I suggest quitting skiing. However, she was really motivated to continue, and her parents supported her decision. So we all made a plan of rehabilitation program, specific injury prevention program, and change in ski racer technique Likely, the coach accepted our suggestions, and all of that resulted in successful return in competition. After two really good seasons with good record, she decided to study in States and to compete at university level instead of World Cup competition. The opposite story. The guy on the right hand side came to me with his parents and coach when he was 14 for some functional assessment, and I took a chance to suggest an injury prevention program as a part of daily training. Luckily, the parents were very dedicated and the coach accepted the program, so the guy had a nice record in the youth ski competition before he decided to put more attention to studying. Besides previously mentioned facts about injury prevention, I can warmly recommend application Get Set Train Smarter. It's a scientific based and totally free application with videos and appropriate descriptions of exercise for injury prevention for different sports. Nowadays, almost 36. But for alpine skiing, as for other sports, you can find a 3 level of workout program, and software allow you to select some of them and make your own program. From my point of view, a really useful and besides that free application for starting an injury prevention program for your athlete. If you're more interested in this topic, I recommended these articles. All of them were published within last 5 years, and you can really find some specific details about mechanism of injury and some new approach to injury prevention. I would like to thank you for your attention. I hope that you understand my variety of English language, and I really hope that we will see each other very soon in traditional academic environment. Till then, stay healthy and happy. Cheers.